For over 200 years, there have been claims that coloured filters in the form of tinted spectacle lenses or transparent coloured overlays can aid with reading performance and cure dyslexia. These claims remain highly controversial, with publications making such claims having generally been criticised for lacking traditional scientific research methods and analysis. In the 1980s, a New Zealand teacher by the name of Olive Mears and an American psychologist by the name of Helen Erlin worked independently, documenting improvements in reading abilities with coloured overlays. This problem was later termed Mears-Erlin or scotopic sensitivity syndrome. Subsequently, the findings of more recent randomised controlled trials have been highly critical of the approach used by Erlin method practitioners. One recent study suggested no immediate effect on reading in children with reading difficulties with these coloured overlays. A recent systematic review of this topic from studies who have adopted methods consistent with scientific literature has provided some key findings. The first finding is that coloured filters can alleviate symptoms and improve performance in people who suffer from visual stress. Visual stress is sometimes known as pattern glare, and it's a symptom-based diagnosis characterised by visual perceptual distortions, headaches, and eye strain. And this can be induced by looking at patterns such as print on a page. The proposed mechanism is that the repetitive stimulation creates hyper-excitability of the visual cortex, and by altering the spectral composition of the retinal image, you can reduce this brain stimulation. The second key finding is that only a minor subset of patients classified with dyslexia, which is estimated to be about 20%, have symptoms consistent with visual stress or pattern glare. And thus coloured filters are likely to benefit only a small proportion of people with phonological and memory deficits consistent with dyslexia. In my opinion, the controversy associated with tinted lenses is primarily due to the subjective nature of diagnosing visual stress and with choosing the most appropriate colour for improved performance. That being said, subjectivity is not uncharted territory for optometrists, some of which still exclusively rely on the results of a subjective refraction to prescribe glasses, which is better, 1 or 2. These days, we use additional equipment such as handheld retinoscopes, autorefractors, diagnostic drugs that relax the focusing mechanism of the eye, corneal topographers and wavefront aberrometers, all of which provide greater accuracy in finding the most appropriate lens prescription for our patients. Similarly, with visual stress, investigations such as functional MRI are currently being used in pilot studies to assess changes in the visual cortex stimulation with and without the use of these coloured lenses. It is through large-scale randomised controlled trials utilising this type of technology that we are likely to find out with certainty of the changes in the brain that occur with and without the lenses, and for which indications the prescription of these lenses are appropriate, such as for cases like ocular migraine or photosensitive epilepsy or acquired brain injury. So in summary, there's not a lot of strong evidence for the prescription of coloured lenses for reading problems, unless of course there's a concurrent problem with pattern glare. And this is why not all children with reading problems will benefit from tinted lenses. However, if you are diagnosed with visual stress or pattern glare, and you have excluded the possibility of any other ophthalmic problems such as accommodative or vergence dysfunction, and you're comfortable with wearing glasses that look different from typical prescription glasses, then coloured filters may be a great option to address your asthenopic symptoms. If you have any other questions regarding pattern glare, visual stress or coloured lenses, please don't hesitate to get in contact. My email is tomroger@ecw.com.au.